So good evening, everyone. So I'm so happy to meet today. You are at IIHS BioInquirer Conference. Actually, I joined when I was a student in IIHS. In 2013, I joined as a presenter of the first International BioInquiry Conference. So it will be the great honor to me join today as a keynote speaker of your conference in nursing and AI practice in healthcare. So, which is today I am contributed in my career as a senior research fellow at National Cheng Kung University and same as in IIHS. So, thank you so much for giving opportunity. So I will continue my presentation. If you want to me my more detail, you can scan me and you can see how my profile or my some academic excellencies. Okay, so I want to say that I would great to say I am alumni of IIHS. I started my bachelor's at IIHS in 2012, I think. So I could finish my bachelor is 2014, and I do my master's also at IIHS in health administration, and I did my PhD in National Cheng Kung University. So I'm a registered nurse, working 25 years till now, and I work more than 20 years in Sri Lanka, and also I have registered in Canadian Nursing Association as a registered nurse. So then, but today message I want to discuss with you guys about my journey, how I become a AI researcher in this health sector as a nurse. So what I learned to build AI and digital health literacy for nurses and healthcare students. When I was a student, what I did, I would like to discuss with you today. And also what I practice, how I use AI, support, monitor, and documentation, even the risk detection or decision support for AI for the healthcare when I was a nurse. So, and also currently I'm leading very few projects about AI in healthcare. So now I'm leading a big project for AI usable of the healthcare with sharp in ethical, equitable, and clinical meaningful AI implementation. So AI is not only the technology, it is the pathway for safer, more human-centered, because we are the human and we take care of the human, and we need to think about how safety for patient when we do the technology. So that's my main focus today presentation. So this is my experience about the AI in nursing and all my research. Most probably I work on the mental health and suicide research in my research area. And also I work on the palliative care and cancer research, even nursing and healthcare practice research, especially my main epidemiology research about the COVID-19, herpes zoster, and those kind of public health topic. And also my part of health combination with this topic with technology in healthcare. And also I do some other nutrition and other small multidisciplinary project. Up to now, since 2020 to 2026, I have published more than 50 publications around this field of research. And even I have pending more research to publish actually. So this research experience helped me to gain my confidence how to lead the multidisciplinary research project. So that's what I want to discuss with you today. And I would like to show how my research journey started. So I started my AI mental health research journey. Actually, I used the nurses' readiness of the technology. In 2013, at IIHS, my first research project, my first undergraduate research project, I checked and that time about the readiness of the nurses in use of the information technology. This research started in the IIHS, and after that, some 10 years time, I conducted my bachelor's and master's to gain the bit foundation how my research influenced to the society. And then after 10 years, I started digital safety in 2020 during my PhD, and 2023 I transferred to the fully mental health research, which is use AI in mental health. And in that case, I try to analyze the facial emotion about to detect the depression of the patient. Then I converted again, enhance the cognitive ability about the patient. I think about what digital tool can see for the enhanced patient activity or patient cognition about social cognition using the digital training. And currently I involved in the STEM education for AI mental health for student, how a student engage AI for development, implement AI tool for detect some intervention for patients care. So today my presentation about my journey, what I did. Okay. So this is my foundation about the readiness of digital health in 2013. This paper I published in Spain in 2024, where 10th Nursing Congress, 10 International Nursing Congress in Spain as a very first time as a nurse in Sri Lanka. So, and also this study I could publish in the International Journal of Telehealth and Telemedicine and E-Health, which is belong to my organization. So anyway, you can see in 2013, still our nurses has 60% has personal email on at that time. Can you believe how our nurses competent to do AI? Not only that, almost 80% nurses, they use computer in their workforce. So during their work time, they use 80%. And 79% of nurses believe computer will reduce their works. I think remaining now it's increase or decrease. I don't have any idea about in Sri Lankan nursing system how important their usage of technology. But in 20 technology systems help them to make their work efficient. So that's what like quite the closed system. They are not exposures, but they don't have time. Yes, we can't. Can you hear me? Because I can't hear you guys properly. I'm sorry.
We can hear you, Professor.
Huh?
We can hear you.
Okay. So if you can hear me. So then the next study I conducted in patient monitoring, digital technology used for the... I want to check whether digital technology can detect risk early. So I conducted one study, emerging digital technology used for fall detection in old adult in aged care setting, because most of the old adult high risk to the happening falls. So this is a scoping review I conducted in 2023, and I could publish in 2025 in American Medical Director Association JAMA Journal. So, and in this study, I included 72 studies and conducted 33 countries. So you can see that in this study, they think that they can reduce the risk of fall by using sensors. The most of the study, they think that sensors can help to reduce the risk of the fall. And also some studies think that the cameras will help more to the prevent fall, and also the some computer related instrument can reduce fall more. So most of the study, they think that sensors, computer, camera will help to reduce, and even a smartphone will help to reduce the fall patient in the health aged care center. And also most of the center, they coordinate with this fall kind of activity using computers. So it's mean in my previous study, I saw that 79 nurses think that computer will help to reduce their workload. So in this study also, we found that computer is the most important part to identify risk of falls in patient. And also the mobile phone, smartphone also will be help to risk identification to detect fall. And also that they use, most of the time they use the alarm system or some notification system, and also they use the SMA notification. So they can send the SMS or a small notice to identify, protect, or while suddenly identifying the fall. So then fall identification can do by alarm system most probably. And also the cloud communication will be help to identify and prevent fall in the aged care setting on this study. And also this study, most important vulnerable population we need to assess fall are caregivers. So you can see the most of a study, they're talking about caregiver. Caregiver is mean we are nurses, are the frontline healthcare team to assess fall, identify the risk or prevent risk. So, and also some nursing staff or nursing home staff and some healthcare people are the most important fall identification system population. On this study, nursing AI can move forward to detection after risk. So that's what we think, that it's mean the detection risk after predicting and preventing the harm would be my theme after I conducted this 72 study. So then during that time, I have some transition in my academic life. I move forward to more toward the mental health. So in that case, I conducted not only, so yes, I identify the digital technology can identify risk. Not only that, we think that about more scientific and more advanced technology, how can use and day-to-day implementation. So then I transfer to the AI emotion detection for the implementation. So we assess the risk, then we are going to implementation of the research. So this is on that time I started my postdoc at National Cheng Kung University. During that time we have our lab, we call mental stress health lab, and this lab we started work on the patient's emotion to detect the depression. Actually, this depression is kind of the negative emotion, so always patient feel negative thought. So because of that reason, we think that we need to how to identify this negative emotion, because the depression patient, they don't want to talk, they don't want to interact in social, so they don't want to show their emotion. So if AI can identify their hidden emotion, it will be help to identify and prevent their suicidal or other risk of the health harm. So in this study, in this time, so in our lab, our team conducted the basic emotion detection accuracy using artificial intelligence approach for facial emotion recognition. This is the systematic review and meta systematic review. So we published this is my very first publication of the engineering journal. Even I'm a healthcare professional, but we can catch the publication through the engineering journal. So I published in the Q1 journal, Applied Soft Computer, in this study. This systematic review, we use the how to explore the basic emotion accuracy rank based on features, algorithm, database, and facial emotions recognition system, and seeking the opportunity for facial emotional recognition system to be in the future healthcare. And we use all the database which we conducted in the facial emotion or photo, video, those are our population. And our intervention, our major impact, we want to explore facial emotional recognition system and machine learning method, including algorithm or facial features. And we don't have any comparison and outcome of the accuracy of the facial emotion system and most of the journal paper. And in this systematic review, we included 35 articles, and we found that you can see that in digital technology can see the positive emotion more frequently. So it means you can see happy and surprise they have high accuracy, more than 95 accuracy for the happy and surprise. But sad and fear and anger is the lower accuracy. It means anger, sad, fear is still hard to be detected. And also this study, we found that most of the study, they use the machine learning and also deep learning. But the deep learning quite overall accuracy is quite similar, but there's a very fluctuation of the machine learning approaches. So, and also they use the JP database is the most important database. 12 study they use the JP, and at JP database has high accuracy to get the information. And also we check about what kind of facial features were most important to detect this kind of happy, anger, sad, like these emotions. We found that face region and nose, face regions and eye, face region and mouth, those whole face, some region are high accuracy, especially vectors of faces, region of faces, and vectors of detection energy, and vectors of eyebrow changing. Those areas are more important to identify this negative and positive emotion. Actually, we are nurses. What we do at very first time, when patient come to us, we look at their face. So as a nurse, we can see where we look at very first time. In the mouth, in the nose, or in the eyebrow? No, we need to see at once full face to guess the facial emotion, whether they are depressed or not. But it is hard for nurses to do because of their heavy workload. Okay, so then what we can do, we can take one picture and we can give that picture to AI to see whether this patient is happy or sad or they are depressed or not. So based on this study evidence, what we do next, we think that what we can do next. So we are trying to develop our own project to identify the emotion based on this study finding. That's what we concluded. It means deep learning is more advanced, and there's an uneven performance in each emotion. Like you can see that positive emotion are more prominent to detect, negative emotion little hard to detect, and anger is the lowest accuracy, but the depression patients has more time anger. So those kind of, and also the data set and features are the main technical thing we need to consider. So in this research context, data is very important. So that's why we collect more data to identify which one is the best way. So next study, then we think about this is the time we think about our clinical translation. We do the ICME system to depression detection. We think that artificial intelligence application can use for facial emotion expression detection. This is our first invention to see the facial emotion. So what we did, we try to collect the stressful event by narrative with the patient. We use the PHQ-9 and BSRS-5 for depression detection scales, and we collect their 10 minutes video while we are talking. What we did is, while we are talking with the patient about their stressful event, we collect their data, and while collecting data, we record their facial emotion. And then we ask them to write down this how they feel their stressful event by written, stressful event by narrative, and we expressions of the emotional state. So then finally we asked her to take, okay, let me tell now your emotional status. When they see happy or sad or not, whatever situation, we quickly take the picture. So, and then we give to the AI to record those things. This is the way how we do. This is our architecture, how build up our system to detect. First, we take the image, and then we do the VI emotion recognition system, basic emotion prediction, and also we give the neutral network identification, how how PTL faces extract out, how which area we need to take out to identify the AI system and AI emotion identification. And also we do some, based on this, we do some statistical, and we do this random porous classification system. Then finally we divided to this patient three category actually. Those they don't have depression, they have mild depression and severe depression. So this is our depression detection system now achieve 86.25 accuracy predicting depression in 10-minute facial video in 2020. So this is the demographic data. You can see that how correlation, how accuracy and prediction, and also we do the cluster analysis, and our most risk group is the younger, single and psychiatric patient. They can detect depression, and their depression score high compared to the PHQ-9 or BDI score to our then this study, I would say that this year we published this study in the Journal of Affective Disorder, top 10 journal in psychiatric, and we also do the public empowerment using our ICME in the Medical Care Congress in Taipei in 2025. We explore how to use our ICME, and also we apply for patent to the US for this ICME innovation translation. And not only that, also we develop another software, the conventional AI listening depressive symptom. Actually, it is the AI artificial intelligence chat box to detect the depression system. The artificial intelligence has personalized interaction, because you can type your emotional status to the app, and app will give you your current emotional status. Then this one not involved. This is the personalized system. So this AI chatbot collects the depressive symptom by the patient and using BSRS-5 score. And this is a smartphone based conventional AI app. And also we receive 80% accuracy, and we use 80% data to the train and 20 for the testing. And this is the whole system, and we use the chat box. We can chat with this, and we do the symptom emotional. We use the symptoms, emotion, and thought to degree bar, and logistic to the tag-in, and we do the weighted coefficient. And this system also, we until now we see the 83% accuracy and measurement tool for the depression use. And we conducted 35 students from 28 academic patients in psychiatric department. And we found that our AI emotion detection system correlated with the patient-reported system by BSRS-5. And we found that the significant positive association with AI predicted and self-recorded BSRS-5. And AI predicted BSRS-5 also correlated with physician-recorded euthymic PHQ-9 data. So those are our system what we develop for our mental health. And then based on now we have to develop instruments. So now we come to this to get with the student, because we work in the university. We invite to our student to see the clinical scenario. So then we come to this application, apply in the clinical scenario, and we application. And first we use the not only the AI emotion, we collaborate with the HRV, the heartbeat detection, and also positive emotion. There's a correlation about heart sound and our emotion. Actually, yes, if we are more anxious, more stressed, our heartbeat go increase. So because of that reason, we collaborate with this our system, which clinical validation with the HRV. So we think that how correlation with the emotional and heart activity. And also we found that this and we go this personal HRV music and mental health care in scientific evidence with developing app. So we conducted 2 workshops for the student, undergraduate student, and how we see they are anxious during study time, during assignment, during the clinical practicum. So, and we found that several correlations about those things. And then we integrated AI power personalized music to our intervention, and we found that there's a more helpful music for the reduce your emotion, as know. So AI music can do same thing. And also we ask to student to do some case study, how signal use, how HRV analysis, how music connects senses, and AI may personalize changes, and real-time feedback, clinical wellness. Those kind of topic we discuss with the student, how to implement new devices. So actually we found that very good progress of our student from zero foundation to AI application phenotype. So this is our research team. What we do, our STEM education, we preparation, analyze, design, planning, and implementation and evaluation for our course. And during this our course, you can see our student practice our AI tool, and they have conducted plenty of new project, and they have innovative idea about this. And those are in our region. And recent been then we learn from the prototype how our within 1 month a student have more active. So our student, they use HR AI for dementia risk dissection, and also the music-based exercise, mindfulness for eating and stress disorder, and empathy and recovery from the after on-call duty. Those student projects are ongoing with our AI prototype applications. So now students are working on it. And also we conducted very big project. Currently I am ongoing this project, AI mental health development through the multidisciplinary project. This is our project team. I am the international project coordinator. We conducted our STEM project about the planning office, enterprise cooperation, multidisciplinary team, clinical industry, and expert consultation for this project. And in this project we conducted intensive winter course for 10 days, and also the hand-on practice in the 1 week. So in that time, so our students do this course and they use our application and they use our research publication to enhance their knowledge. And what we found, that you can see that pre-post, they are significantly enhance their AI ability, and they do the mental health program. And you can see that pre-post qualitative explanation. And the very first, the pre-test, the expectation, they have many expectation, but after post-test, they think that how this expectation can apply their practice. So this is the what we found, that is when we learn and when we give this our course to student, and very beginning we have more curiosity, then after that we are trying to practice this what we explore from our student. So and they develop very immersive 5 project. They think about time whisper, is time is important. AI can reduce our time, and now the lifter, the AI can help us to lift up our time, and also the lifesaver, because the depression detection, they use the suicide detection instrument, how to save the life, and also the companion chat box, robotic, how to help to the elderly. And also not only they are thinking about healthcare workers, their stress and their burden, and how AI can help their burden. So CU care. So this immersive project developed within our intensive course 1 week in STEM education in AI. So that's what we are doing in our project now. And we develop our website in NCKU Nursing. You can see, and we also we have our STEM mental health program in LinkedIn profile. You can see and see still our profile highly active. Last week we see that 1K viewers in our profile. So this is my presentation today. Thank you so much.